or minus with a white blood cell stimulating factor. So half the patients just had a biologic treatment for their melanoma. Melanoma has always been a challenge for chemotherapy doctors. And the other half of the patients had an agent to stimulate white blood cells. So often chemotherapy suppresses the blood counts. The idea of something to stimulate the white cells is to avoid that kind of problem. So the study included 245 patients with unresectable stage 3 and stage 4 metastatic melanoma. So it means the melanoma spread from the primary site to another site, and they had not undergone treatment for their disease. So they were virgin patients. So virgin patients obviously do the best because the more treatment you've had, the more resistant cancers usually get from chemotherapy. That's not true with radiation, radiosurgery. They don't usually get resistant.
Why is melanoma such a problem for doctors?
Because it doesn't respond very well. Standard dose radiation doesn't work very well. Most chemotherapy agents, which have been used for decades, don't work very well. I mean, even in this study. So this is a study, and I'm sure you've heard friends and neighbors who line up. They have a new protocol. They're so eager to get on a new protocol for their cancer. So what's the result? So these patients did get on that protocol that everyone wants to get on, let's say. The follow-up was 13 months for 245 patients. They were unresectable, again, metastatic. And the overall survival was, in the treated patients with the white cell stimulant, was 69%. Without it, it was 52%. Overall survival. So you're talking about almost a third or the half of the patients dying within 1 year.
Wow.
And so it's a very serious condition. Tumor shrinkage for the combination was only 11%, and in the immunologic arm was only 14%. So actually you can see that even the ability to control the tumor only occurred at most in 14% of patients. So you can get a sense that systemic treatment is still suffering from a lack of effectiveness in general. Obviously, there's going to be research that goes on and on. We often treat patients with melanoma with radiosurgery because it is very effective where we aim the beam, and usually we see very good results where we treat. We have John on the line from Staten Island who has a question. So good morning, John. How are you?
Good morning, Dr. Gil Lederman, and good morning, Rob.
Good morning.
Dr. Gil Lederman, I'm familiar with you because you did work at Staten Island University Hospital, am I right?
Yes, sir.
Right, so that's where I'm familiar with you. I'm on Staten Island myself.
Okay, what's your question today?
Okay, my question, sorry. I'm 57 years old, and I was diagnosed with HPV.
You should turn on, John, just turn off your radio because we're getting the static background.
Feedback, yes. And so I'm wondering, now I go to Dr. Bloom at SIU.
Okay.
And what they do is they take a sample and then they send it off to him.
Okay.
And I had to go under this vinegar that burned me, and they put me out. And I have the virus, but I don't have cancer. I don't understand this. Do I have to do this procedure every year? Because this year was very bad. I did it my first time last year in 2012, then 13. And it seems like it was unnecessary for me to have to go through all that. And then I had to soak in I forget what they call that.
John, what I'd suggest is, I need to know more about your medical condition. So for you, there's just not enough information on the radio, and it's best to provide me the information, come in, make an appointment, and we can go over all the details and discuss it in person so we have the best possible amount of information for you. I wanted to bring several other cases that I saw this week. One was a gentleman with metastatic lung cancer.
Okay.
So he had 3 sites of cancer. He came coughing profusely blood.
Wow.
Every time he coughed up blood. And I don't know if you've ever seen in your career someone who drowns in their own blood, but it's really, really, really frightening and devastating.
Sounds terrible.
I encourage this man to be hospitalized. He didn't want that. He wanted treatment. He had had chemotherapy, which didn't work. He was probably coughing up blood every minute or 2 minutes.
Terrible.
So we treated him with radiosurgery. He had one lesion that was a main lesion about 5 centimeters by the left hilum. The hilum is a area where all the blood vessels and airways go into the lung and come out from the lung. So I thought that was the most likely source of the bleeding. So we gave him 5 treatments. It was outpatient, 15 minutes, come in, go home. And within a week, all the bleeding stopped.
Within 1 week?
Within 1 week. So we usually give about 2 treatments a week. So he was obviously very, very, very pleased. I was very pleased too, and very relieved, I should say.
I'd be pleased.
And we then treated the other 2 lesions in the lung. And he just came back this week for follow-up, so that's why I put him on the list. So it's now been about 2 months since that day that he first came in. He's doing very well. He had pain also, which is resolved. His bleeding is resolved. He's fully back to normal, smiling, which he was not doing 2 months ago. And for him, we'll get a follow-up PET scan, which is a way to follow the cancer, and he'll have a report in his hand to know the results, but he really knows the results already, that he's responded to the treatment, which is really gratifying for us.
That's incredible.
Yeah, it's really gratifying. We had several other patients that were interesting. I spoke 2 weeks ago about a young woman with breast cancer, 35 years old, who was in the hospital 2 weeks ago on morphine. She had breast cancer newly diagnosed at age 35. She presented with a nodule in the breast and bone metastasis simultaneously.
Okay.
So 2 weeks ago on a Thursday night, she had terrible pain, was hospitalized. She had an MRI. This is elsewhere. I was not in charge of her hospitalization. She had an MRI. She called me. I encouraged her to come in. She came in. We treated her. And after 2 treatments, her pain went completely away. So, again, it's a nice result, and I was obviously very happy about that result. And we had one more case. I had lots of cases, but I don't want to bore anybody. We had one woman who came in. Her children came in. Her daughter was from Louisiana. Patient came in, and I got the history. And the history was that she had lymphoma.
Okay.
And the lymphoma was treated with chemotherapy, and now the cancer has progressed. And we have a caller, and we're almost at the end of the hour, so we're a little bit squeezed here. But I just want to make the emphasis that for this patient, we got the records, and we gave her the records. It was the first time she ever saw her records. And, in fact, she did not have lymphoma.
Wow, okay.
She had carcinoma, which is a totally different disease, and we'll talk about that in the next week. The PET scan that she got elsewhere showed cancer that had spread to the lumbar spine.
Mm-hmm.
We got an MRI of the lumbar spine, completely negative. So she walked away thinking she came in thinking she had lymphoma that was spreading to the spine.
Right.
She walked away knowing that she had actually carcinoma, and it was confined, and it was not spread to the spine.
Wow.
So that's why I often tell people it's really better to come in, let's go over the documents, than just tell me on the phone or go back to my doctor and I'll see my doctor and what he says. You should see your doctor, and everyone should see their doctor, but you should also, if you have doubts, get a second opinion and let that second doctor go through everything independently. Look at the reports, examine the patient, go through the records, and see exactly what's going on. We have Sally from Warwick. We cannot get to you, and I'm happy to speak to you if you call our office. Our office number is 212-CHOICES, 212-CHOICES. You can call during the week and ask me any question you want. We'll be back next Saturday. Rob, thank you. Aaron, Coop, thank you for your care. Have a great weekend, and thank you for all your support. See you next weekend.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-246. 246, 246, 246, 246, 246, 246.